Hello, good evening. This is Dr. Parijat, the Director of International Sports and Orthopedic Manual Therapy. I am here to discuss answers and explanation of our sixth webinar case study discussion. All right. I hope you secured good marks and you will receive your certificate of participation automatically on your email ID within 24 to 48 hours. So I hope you mention correct information on the quiz. So our first question would be actually, would you like to enroll in ISOMT membership? We would be having a lot of benefits in this membership, and we will have another video or explanation of what all membership benefits would you have if you sign up for ISOMT membership. All right. So coming to the quiz, our first question was, which of the following reason is the primary cause of Jasprit Bumrah, an Indian cricket fast bowler, lower back lumbar spondylolysis? So he had actually a fracture on the left side of his L4, L5, which is very common. The correct answer for this is movement impairment and control dysfunction. The other factors which are mentioned, like short run-up or the bowling action, they were mentioned by the other people, but our question is very specific as which is the primary cause. The primary cause is actually the movement dysfunction, which is, I explained in the webinar, which is the ipsilateral trunk flexion and the contralateral rotation, which is actually putting more pressure on a fast bowler's lower back. All right, so it's actually a movement control or a movement impaired dysfunction is the correct answer. Our next question was, which of the following shoulder range of motion deficits or imbalances are most common in an overhead athlete? The correct answer for this is actually glenohumeral internal rotation, and this is because when I have an overhead athlete which with an action of like a abduction and external rotation, this causes a posterior shoulder contracture. And if it causes a posterior shoulder contracture, it restricts in internal rotation. So my internal rotation gets restricted. So the correct answer is the glenohumeral internal rotation range of motion is more restricted. So you have more deficits in the strength as well as in the range of motion. Our next question was, which of the following muscle is mostly impinged between glenoid rim and humerus in the posterior shoulder internal impingement, which happens in the overhead athlete? The correct answer to this is supraspinatus. Yes, that's one of the most common rotator cuff muscle which gets impinged between the glenoid rim and the humerus when you are in this throwing action. All right. The next question was, which of the following measure is out of a physiotherapist, evidence-based manual therapist limitation to diagnose a cervicogenic headache? So cervicogenic headache, you can't really check those. The correct answer for this is eyesight measurements. It is out of our limitation that we cannot check the eyes. We can ask for the eyesight measurements whether there are changes in a differential diagnosis, but eyesight measurement is not our forte to measure. Next question was, which of the following aspects of testing for sciatica or hamstring tension was not discussed by Dr. TJ in today's webinar? So people who have seen today's webinar might be knowing that what aspects of this he discussed. The correct answer for this is MRI findings of disc bulges. So Dr. TJ didn't discuss MRI findings of disc bulges as a cause of sciatica or the hamstring tension. So he discussed the other three factors. Another question we had is, what is Magnus syndrome? It's a very often overlooked cause of back and groin pain. So Magnus syndrome is actually one of the very uncommon things that people might have heard. The correct answer for this is actually these are spinal dysfunctions at thoracolumbar junction. There are changes from thoracic facet joints, and then when you come on to the lumbar joints, they are more into the another plane, and that's how when the facet joint orientation changes, so as the nerve entrapment changes around the thoracolumbar junction, and this is actually called the sciatica of thoracolumbar junction. So Magnus syndrome is sometimes also called the sciatica at thoracolumbar junction. So that's the correct answer, spinal dysfunction at thoracolumbar junction. Our next question was, which of the following nerve cutaneous branches can cause medial knee pain post-knee arthroplasty or arthroscopic procedures? The correct answer for this is saphenous nerve. So the first option, which is the saphenous nerve, that is the correct answer, because the saphenous nerve goes in a way so that it can cause the myofascial restriction and the nerve entrapment and cause the medial knee pain post these surgical procedures. Next question, which of the following is not a measure of core testing? The options were lumbopelvic movement control, muscle strength and endurance, aberrant motions, and the fourth option was none of the above. Actually, this was a tricky question, and the correct answer is none of the above. So we test all lumbopelvic movement control and the aberrant motions and the muscle strength when we are checking a core. So it's actually a lengthy process to check a core, and so the correct answer is none of the above. Next question, which of the following topics were taken by Dr. Parijat Kumar, that is myself, in today's webinar? Cervicogenic headaches and sciatica? Nope, that's not the correct answer. Sports shoulder injuries and core assessment, thoracolumbar spine and post-knee arthroplasty, sports shoulder injuries and cricket bowlers back injury only. So the correct answer is sports shoulder injuries and core assessment option, which was discussed by me, Dr. Parijat, in today's webinar. Next question, it's a true or false, which says that it is important to assess other regions of any painful or affected side under regional interdependence to get the best outcomes. This is a very common and a simple question, I hope, for the people who are seeing our webinars. So the answer is yes, it's true. You need to rule out the other areas and the regions of a painful site so as to differentiate between what is causing the pain. I hope you learned something from this webinar. We would require your appreciation if you can send us your feedback in the YouTube comment section or email us your feedback or suggestion at isorehab@gmail.com. We hope you learned an evidence-based stuff. Keep learning. Thank you so much.